When Dr. Takesha Presson was limited to emergency and non-elective procedures during the lockdown at her Dimples Dental Suite on Capitol Hill, she noticed a startling trend among patients of color with lower income.
It was mainly the Black population or the people of color that were coming in that were having dental emergencies. And again, these emergencies were situations or conditions that we had already previously diagnosed.
Emergencies that could lead to bigger health problems.
There are plenty of studies out there that show the correlation between heart disease and diabetes, as they're connected to, bad oral health.
She says some of the cases were beyond repair.
A lot of root canals, a lot of extractions, rampant caries, inflamed gums. But in most cases, we literally had to pull teeth because their teeth had just reached the point of non repair.
What Dr. Preston has experienced is not out of the norm. Studies have shown how disparities in oral health care make some communities more vulnerable. According to Pew Research, previous studies have shown higher rates of tooth decay and tooth loss in communities of color. Fewer dental visits and preventive treatments were also factors. Then there's poverty, which has disproportionately affected minority communities for years, creating a hurdle for access to quality health care.
Do you believe there are disparities when it comes to
Absolutely.
dentistry?
Absolutely. There are disparities in the dental industry as it relates to people of color. And it mainly comes down to lack of access to good providers. It comes down to economics. They just cannot afford to get the care.
But while there are systems in place like Medicaid, which works well for Dr. Preston's patients, she says it can only go so far. Makia Turner, WUSA 9.